Hello friends, in this video I am going to discuss about Norma Lateralis, that is the side view of the skull. So first of all we will see the bones which is visible in the side view. So here you can see this is the maxillary bone, we can see the nasal bone, the zygomatic bone, the frontal bone, the parietal bone, a part of the occipital bone and the temporal bone. So these are the bones that are visible in this view, that is from the side view. So there are many features in the norma lateralis, but I am going to discuss only two important features in this view, in this video, that is the temporal line and the pterion. So first about the temporal line. So here you can see this is the zygomatic bone, this is the frontal process of the zygomatic bone, this is the frontal bone, and this is the zygomatic process of the frontal bone. So at the junction of the frontal bone and the zygomatic bone there is a suture which is known as frontozygomatic suture. So the temporal line starts from this frontozygomatic suture, it runs on the frontal bone, it crosses the coronal suture, then it runs on the parietal bone. On the parietal bone, the temporal line is split into two lines, the superior temporal line and the inferior temporal line. The superior temporal line fades away posteriorly, but the inferior temporal line, it runs forwards and it merges with the supramastoid crest, and then anteriorly it merges with the zygomatic arch. So these are the two temporal lines. So the temporal lines anteriorly there is only one temporal line, but on the parietal bone there are two temporal lines, and posteriorly again the superior temporal line fades away, but the inferior temporal line, it continues downwards, forwards, and it merges with the supramastoid crest, and then anteriorly it merges with the zygomatic arch. So on the superior temporal line there is attachment of a fascia, that is the temporal fascia, and on the inferior temporal line there is attachment of the temporalis muscle. So in this way the temporal lines are formed. Now the next thing is the pterion. Very important. It is very important. Clinical aspect is very important. Pterion. This is a S-shaped suture. This H-shaped suture represents the junction of the four bones. First is the frontal bone, the parietal bone, temporal bone, and the greater wing of the sphenoid bone. So these are the four bones that fuse here and form H-shaped suture. Now this region, the pterion, is very important because this region is the skull is thin and it is prone to fracture. So in what happens in roadside accident, this region is prone to fracture, and just beneath this pterion there are important vessels like middle meningeal vein, anterior division of middle meningeal artery. The stem of the lateral sulcus lies just beneath the pterion, and if in roadside accident a fracture occurs here, then there is a chances of the rupture of these vessels. And if there is rupture in these vessels, so what will happen? Blood will clot, and that will lead to extradural hemorrhage, and due to the blood clotting, that blood clot will compress the brain, the motor area of the brain in this region, and that will lead to paralysis on the other side. So to prevent that, the treatment is the sucking of the blood through the process that is known as trephining. So this region, pterion, is very important for the clinical purpose. That's why it is suggested to use helmets while driving two-wheelers. That's all for this video. Thank you so much.